When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.
Hi, thank you very much for joining us again here on the Discovery Show TDS TV. Here we say Yearn to Learn. It's a show that basically interviews professionals in the diaspora and beyond. And the whole idea is really to explore their lives and also to get what their journeys have been so that we can also rise to whatever levels we want to rise to. Today, we are very privileged to be interviewing a man who has been mentioned so many times on this platform, yet many have not seen him before. He's actually the producer for this show, and I must say that he's also a registered nurse here in the UK. Currently, he's working in the Haemato-Oncology unit in one of the big hospitals in the UK. I'll leave those details for him to talk about. But please help me to welcome the executive producer for the Discovery Show TDS TV, Mr. James Oppong. James, you're welcome to the Discovery Show.
Well, Precious, thank you. Thank you for having me. Should I say thank you to the viewers for having me? Finally, you get a chance to see my face.
Amazing, amazing. So like I said, many people have heard the name, and this show is produced by James Oppong. Tell us a bit about yourself. Who are you?
So as you said, I'm James. Officially, I'm James Oppong. I'm a registered nurse currently practicing at the Queen Elizabeth Hospital in Birmingham, UK. James is the last born of a family of 5 boys, humble beginnings. Had my basic school education in my hometown, Pampanase. I attended Kofia JLA Primary, JHS, and then went on to Agogo State Senior High School in Agogo, Asanteachem. And then to the university of choice, the best university in Ghana at the moment, according to the latest rank at UCC. So from UCC, I did my national service in Samraboy, Samates Hospital. And right after national service, I got a chance to come to the UK. So that's what the trajectory has been so far.
Interesting. I'm sure we'll delve a bit more into that going on. But I mean, I've always briefly spoken about what the whole idea of TDS is about. But would you want to take this opportunity to expand that further? How did that start and what has been the journey so far for the TDS?
Well, okay. So personally, I'm someone who loves to help people, love to give information to people. So when I had this opportunity to come to the UK through the overseas nurse recruitment, I kept thinking about how I can help others and I can empower others who are interested, obviously, to also come to the UK and then get better working conditions, get better career progression, and hopefully together at some point we can also go back home and make an impact. So I was thinking around that. I was doing it in my own way, talking to people on individual basis. But I also believed in the power of the internet, that if I do something on a bulk level, I can reach larger audience than what I was doing on my own. So I was having those ideas. And in 2019, I met you, Precious. Somewhere latter part of 2019, I met you. We started talking about things in general. And then one day during our conversation, we realized we shared similar opinions of helping people. And we believe that most people are intelligent, smart, and brilliant back home. What they lack is the right information and people to signpost them. And then again, sometimes what they also lack is people to look up to, like to see, oh, someone in my category or someone just like me has done this and has been able to achieve it. So I can also do it. So we decided to come up with this program so that we interview people and who can share their ideas, their journey, and then through that, others will also be inspired, and then together we'll build a strong community. So that was the idea behind TDS, and I think that's what we've done so far. I think we finally created the channel in 2020 around March. We had a bit of difficult start. We had so many challenges, but through it all, yeah, we've come this far and we are here now. So that's been the story of TDS briefly.
Thank you very much. Would you say at least we've managed to achieve something so far? What do you think? How will you assess the program so far?
Yes, I think we have, because sometimes the feedbacks we get a lot of feedback, and some are very positive. We get so many positive and encouraging words from people, and I think it's those encouraging words that keep us going, because it's so heartwarming to get someone to say, oh, I watched this, I got this information from TDS and it helped me. Oh, I didn't know about this till I watched TDS and it helped me. So those words of encouragement have really kept us going, and that's what brought us so far. We're not where we wanted to be yet, but we've made progress.
Amazing. Thank you very much. Viewers, thanks very much for sticking and staying with us. You can drop your comments, your questions for James, and obviously I'll definitely ask him. If this is your first time watching, this is the Discovery Show, a show basically interviewing professionals in the diaspora and exploring their lives and what opportunities exist in their pathway. And we are speaking to James Oppong, who is the executive producer for this show. He works in the Haemato-Oncology unit in one of the biggest hospitals in UK, and he's explained a few things with us so far. So James, let's talk about career path so far. You did give us a brief about your life. You moved from Ghana to the UK, and then of course I know you've changed trust as well. What has been that for you? What were the decisions you did consider before making those career choices? I know you are into Haemato-Oncology now, so tell us a bit about that career path.
Yes, so I'm one kind of people close to me will know that all the way right from school, I was looking for opportunities to go out, better myself, and at some point, hopefully come back to Ghana and make an impact. And one other thing that also helped with that decision was at some point in school, final year, getting to national service, someone very close to me was diagnosed with a type of blood cancer. I was just a nursing student in the final year. And this friend was so close to me. So when she goes to the hospital, get the chemotherapy medications, obviously all the side effects of the chemotherapy, hair loss, darkening nails, and all the others, was worrying. And then, so I, having a health background, had to read about it and explain to her, oh, these are normal, these are expected, you go through it. So from that point, my interest in cancers and blood cancers, because the person had a blood cancer, and in blood cancers developed. And looking around me, there wasn't much going on in blood cancer care in Ghana. I remember during our school days, we had a placement in Kolebu Teaching Hospital. That was where I saw something with hematology care. Aside that place, none of my clinical placement that I came across any hospital having a hematology unit. So I decided that if I want to do much when it comes to hematology or cancer care, I have to move out and get the required experience, and maybe at some point come back home and make that difference. So when I saw this UK overseas nursing recruitment, I saw it as the right opportunity. So I came to UK, and obviously, you know, when you come in at first, you come in as a general nurse because you don't have any specialty training. So I came as a general nurse, came to a general medical ward in Surrey and Sussex. After 2 years, I felt like I've had my basics in the NHS. I've had my grounding. So it's time for me to move on and pursue the dream or why I came here. So I was looking around for hospitals that do a lot when it comes to cancer care and blood cancers. There were a few hospitals that came up in my shortlist. Currently, in cancer treatment, there are advances. There is one treatment that's very advanced called CAR-T treatment. So when you have a center that do something like that, then you know the center does almost everything when it comes to blood cancer care. And there were about 11 hospitals in the whole UK that do CAR-T. So some in London, Manchester, Birmingham, Leeds. So I was narrowing down, and then I settled on Birmingham. So that was when I applied for a job in Birmingham Haemato-Oncology unit at Queen Elizabeth Hospital, and I got a job, and I moved to Birmingham in 2019. So that's the trajectory, and that's what has influenced my decision. And I found myself in Haemato-Oncology now.
Thank you very much. I mean, obviously, you cannot throw away your background. Where we're coming from, you know, like you did mention, the cancer care is not really well advanced. And so there are a lot of stereotypes, a lot of stigma, a lot of, I mean, that sort of misconception around cancer and all that. If there's anyone watching us, what will you tell them if you have to explain to them in basic terms what cancer is about, what the hope is for people who have all types of cancer before we narrow it down to what you do? What will you tell people watching?
Okay, so I'll start briefly with what cancer is. I always say it's very difficult to explain cancer in a layman's way to try and avoid jargons and explain it, but I'll do my very best. So in basic elementary science, we were told cells are the building or the basic blocks of life.
Yeah.
It's correct, it's true. But it goes beyond the cells. In the cell, there is something called the DNA. So when the cells, and every day our body make billions of new cells. Our cells are multiplying, they are dying, new ones are being made. And in the DNA that sits in the cells have genetic code or information, let me say. It has information. So you have cells in your eye, cells in your leg, cells in your hair. So that cell that sits in your hair, there is an information in there that tells that particular cell, you are a cell for the hair.
Okay.
This is how you divide. This is what you do. This is the place you have to stay. So there is that orderliness in cell division. Now there comes a time through so many factors that the division of those cells, when the information is being passed on to the next generation, there is an error in it that we call mutation. So when that error occurs in the division, now you will have a faulty cell. So the cell that is not doing what it's supposed to do, or a cell that is not supposed to be at where it's supposed to be. Now, when you have that faulty cell and they keep growing, so now you have a generation of a faulty cell. So that faulty cell will also divide into another 40 cells, and you have those cells also multiplying.
Okay.
And now we have some things that we call hallmark of cancer. So as I said, that division is very well organized, it's orderly. When the cell becomes cancerous or when there is a mutation in it, they get some characteristics. Now they don't listen to the orderliness in the system. They divide uncontrollably. They don't die. Cells are supposed to die after some time. Now they don't die. Cells divide when there is a signal. So for instance, when we have like the army will only do recruitment when we know that we need people to come in. So cells divide when there is a signal that no, we need people to come in, then they start dividing. But when the cell becomes cancerous or when there is a mutation, they don't wait for any signal to come and they keep dividing.
Okay.
So when they are dividing, they are not dying. So what happens is that, for instance, if it is in your breast, they will divide, form a lump, and then we'll call it a breast cancer. Prostate, they will divide, they are not dying, they are not performing the function that they are supposed to function, then there's a prostate cancer. So we have so many types of cancers. Anywhere in the body that there is a cell that's dividing, it can become cancerous. So briefly, that is what I can say about cancer. As I said, it's very difficult to try and explain it in a layman's in normal plain language, but that is it. Someone may ask, so what causes that kind of error in the division or for the information to be passed on? Science don't know the exact cause of cancer, but we have contributing factors. So for instance, we can say, oh, something like smoking predisposes someone to breast cancer, lung cancer. We have environmental factors. Exposure to excessive sunlight can lead to skin cancer. We have so many other factors. Even some people are born with genes that predisposes them to some certain types of cancer. Typical among them, there is a gene called, I'm trying not to say jargons, but there is a gene called BRCA1 or BRCA2.
Okay.
Some people are naturally born with that gene, and that gene predisposes them to breast cancer, prostate cancer, or ovarian cancer. It doesn't mean that when you are born with BRCA1 or 2, you will definitely get these cancers. It just increases your risk of with this BRCA gene is one American celebrity called Angelina Jolie. So she had a family history of breast cancer. And then she did genetic sequencing. She sequenced her whole gene and then realized that she had that BRCA gene. So that means she was at risk of breast cancer.
Okay.
She opted to have her both breasts cut off just to avoid breast cancer. And I think sometimes she was thinking of having her ovaries removed as well because she knows she is also exposed, has a risk to ovarian cancer. So in a nutshell, that is how cancer occurs, and those are some of the contributing factors that lead to cancer occurring.
I'm very impressed. I think, to the best of my knowledge, you've tried your best to simplify or explain what cancers are in a layman's term. And thanks very much. I can see messages coming in. We read that to you as well. But of course, you work in a Haemato-Oncology unit, so you are more focused on blood cancers as well. Can you take us through that, and what is that day-to-day activity in that unit? And secondly, can you speak to people about what types of cancers we have if we talk about blood cancer? So now you're talking about cells. I know growing up, when we hear cells, we're only thinking about something more solid. You can touch your skin and it's more solid. That is a cell. But of course, it goes beyond that. How can you tell us that we have blood cancers when it is liquid in there? So I'm just trying to mention one or two of the misconceptions we knew whilst we were young and growing up. Can you educate us on what blood cancers are? What sort of treatment is available for people? Is there hope for people at all who have these conditions?
Yeah. Thank you, Precious. Before I go on to blood cancers, I would like to say something in general about cancers. From where we come from and growing up, as you said in your introduction, it looks like when we hear of cancer, it's like a death sentence. But what I want to tell people is that at the moment, with the treatments and advancement in science, I want people to see cancer as any of the other chronic conditions. For instance, hypertension, diabetes. Up till now, some cancers are still not curable, but they can be managed. So it's not a death sentence. And then coming back to your question about blood cancers. Yeah, so as I said earlier, that looking at how cancers develop, that is an error in the coding of cell division. That means every part of the body that has a cell can develop a cancer. And blood, there are cells in our blood. So we have red blood cells, white blood cells, we have platelets. Those are the cells, some of the cells that we have in the blood. So once we have cells in the blood, that means we can have cancer in the blood. There is also there's not a misconception, but there is so much lack of awareness about blood cancers, even in advanced countries. So there is a charity group in the UK called Myeloma UK. They have a video on their LinkedIn page. They went to the streets of London and were asking people, give us 3 examples of cancers you know. And out of about 20 people they asked, I think only 2 of them mentioned any blood cancer type. That goes a long way to tell you that naturally people are not aware of blood cancers. We know of the breast cancers, we know of the prostate cancers, we know of the lung cancers. Hardly do people think about blood cancers. And even doctors or people in the medical profession, when people present with certain types of symptoms, hardly do they add any type of blood cancer to their differential diagnosis. So then most blood cancers are diagnosed at the late stages, or blood cancers are accidental diagnosis. Someone came to the hospital for something else, bloods were taken, and we realized the person had white blood cell count is over the roof. We probe why, and then we realize the person might have a blood cancer.
Okay.
So blood cancers do exist, and we have to think about them. Medical professionals, doctors, physician assistants, physician associates, we have to think about them when we are doing our differential diagnosis. When someone comes to you with bone pain and with everything, we have to think about possibility of a blood cancer in the midst of all the other differential diagnoses we have.
Interesting. Thank you very much, James Kobna Oppong. So, I mean, viewers, we just encourage you to subscribe to our channel here on YouTube, on Facebook, on Twitter, and then on Instagram. The name is The Discovery Show TDS TV. The Discovery Show TDS TV. Please subscribe to our channels. And then, of course, as you can see, the names just scrolling at the bottom of your screen. So, I mean, James, let's delve a little bit into this. You did explain that, but will you want to explain a little bit more, like you did mention, that it's not a death sentence, as people usually talk about. What are some of the things, assuming someone is home, you haven't been to the hospital yet, is there anything specifically that will draw your attention to the fact that what you're experiencing or this symptom perhaps may be pointing you in the direction of cancers in general or blood cancers?
Yeah. So for cancers in general, specific type of cancers have specific things, signs and symptoms that we look out for. And
okay, let's focus on blood cancers. Yeah.
Okay, common among them, something like breast cancer. So, though I'm not much into oncology, I'm much into hematology.
Hematology, that's right.
It's Breast Cancer Awareness Month, Pink Month, October. So And then my first degree, I know, although first degree project work is nothing much, but my first degree project work was on breast cancer. So I have a bit of interest in breast cancers as well.
Okay.
Um, so something like breast cancer, I know now the awareness is coming up strongly
Yeah.
about breast self examination among ladies. Um, One of the key things is finding a lump that feels like, so it's called pale orange. It's from a French word like a peel of orange. So that you will find a lump in there that feels like an orange peel, a bit rough. So that's one of the significant signs of breast cancer.
Okay.
Something like a lung cancer, if you start coughing and coughing out blood in your sputum, it can be so many other things. But then again, it could be lung cancer. So I think the thing that makes cancer diagnosis a bit difficult is that most of the signs relate to so many other conditions.
That's right.
So then that's why you have to probe further. We have to do biopsies. We have to, for instance, for even blood cancers is even worse to diagnose a blood cancer, because almost all the signs of blood cancers are signs for different conditions. They are
Okay.
same because blood is liquid, is flowing, so it's not like a solid organ like a breast that you can find something in there. So when you have a blood cancer, you just have vague symptoms like night sweat, you'll be losing weight, unexplained weight loss, you'll be having some bone pain, which I will explain why some blood cancers give bone pain a bit later. Those vague things, bone pain can be anything. It can be that, oh, you overworked yourself and you're having a bone pain.
Okay.
So it's very difficult to diagnose cancers with just the signs and symptoms. That's why we go further to do CT scans, MRI scans, or bone marrow aspirate, and we'll do biopsies as well. So those are some of the ways we can identify. But when you have the signs, when you have the symptoms, just report them, and then the medical professionals will then probe further and then do investigations to find out why those symptoms.
Thank you very much, James.
Meet Mr. X, an unhappy businessman who has been waiting for days for his goods to be delivered. Unlike Mr. X, business is booming for Mr. K because of his efficient partnership with Hembeck 60 Hub, also known as HP 60 Hub. We are an online platform that sources for goods from across the globe. We only pull high quality standard products from anywhere in the world and ship them right to your doorstep. Be it watches, clothes, bags, and many others, do get in touch by contacting us on www.henbeckagency.myshopify.com, or you can call us on +233 546 022 952 or hembeck@gmail.com. Hembeck 60, truly a world of endless possibilities.
Thanks very much for sticking and staying with us here on the Discovery Show. So, if wherever you live, any part of the world, if you want to source for the best of footwears, clothes, watches, bags, and books, if you want to buy them and ship them over to another country, the best company to contact is Henbeck 60 Hub. Henbeck 60 Hub. If you want to buy books, bags, watches, clothes, if you want to source for these from the best of, producers, manufacturers, or, retailers, and you want to send them across to any other country, contact Henbeck 60 Hub on +233 546 022 952 or henbecktravels@gmail.com, or just send them a message through Facebook Messenger and they will definitely respond to you. Henbeck 60 Hub, truly a world of endless possibilities. So, James, I've heard stem cell register and all that. Can you take us through that, since you are more into oncology and hematology as well? What is that about?
Okay. So before I talk about stem cell register, let me talk a bit about blood cancers, just to build up to stem cell register.
Yeah.
So blood cancers, as I said, there are cancers that affect the blood cells. There are so many different types of blood cancers. Common among them, or the key ones, we myeloma, and then we have lymphomas.
Can you repeat the first one? Your line dropped.
Oh, so we have the leukemias,
Yeah.
we have myeloma and lymphomas. There are so many other ones, but these are the common ones. And with the leukemias, they can either be acute or chronic. So acute is the ones that are quite aggressive. They happen and progress rapidly. Chronic ones are slow. They progress slowly. So just the leukemias, you have two classes, either acute or chronic. And then you come down. So when we have something that we call stem cell, there are stem cells there are different type of stem cells. So it's the stem cells that divide or grow into a specialized cell. So when we come to blood, we have blood stem cells, or what we call pluripotent stem cells. So they divide into so many types of blood cells. Now, the stem cells, when they are dividing, they go two ways. So they either go myeloid or lymphoid. So you can have a leukemia in either the myeloid or the lymphoid side. So when you have an acute leukemia at the myeloid side, it's called acute myeloid leukemia. And then when you have an acute leukemia at the lymphoid side, it's called acute lymphoblastic leukemia. So you come down again and you can have chronic myeloid leukemia or chronic lymphoid leukemia. So we call them AML, CML, ALL, or CLL. So that's the leukemia side. We can have myelomas, or we also call them multiple myelomas, because they can happen in different parts of the body at the same time. And then we can have lymphomas. Those are cancers of the lymphatic system. So the lymph node and all those ones. And it will surprise you to know that myelomas are common in people of Black and Caribbean descent.
Okay.
Myelomas are common in people of that descent category. So those are blood cancers. Now we treat cancers with chemotherapy, immunotherapy, or monoclonal antibodies. I don't want to go into much details. So chemotherapy, we are all common. We've been hearing chemotherapy. Now, what chemotherapy does is that it kills fast-growing cells, because we know cancers are rapidly dividing and they are not listening to all the stop mechanisms that the body puts in place. So we give chemotherapy and it kills every fast-growing cell. But the unfortunate thing is that it's not only cancer cells that are fast-growing cells in the body. Cells like your hair, like your nail, like the guts in the digestive system, those are cells that also naturally develop rapidly, but in a controlled manner. Now, we're giving chemotherapy that's killing fast-growing cells. It's so far as you have fast-growing cells, it's going to kill you.
Can you say that again? Your voice dipped. So far as you
are a fast-growing cell or a rapidly dividing cell, chemotherapy will kill you.
Okay.
So that is why chemotherapy has side effects such as hair loss. Anybody who has had chemotherapy can also tell you that the nails were darkened. They were having diarrhea or constipation.
That's right.
Because those cells that are fast dividing are all being affected. and there are cells that are in those places.
Mm.
And now science developed, and we were like, okay, though chemotherapy is doing the work, but it has all these nasty side effects.
That's
And we
right.
had some things that we called immunotherapies. So in the immunotherapies, we have things that we call some things like checkpoint inhibitors.
Mm.
So for instance, as I've already said, that the cells are rapidly dividing, they are not responding to anything.
Mm.
So for instance, if it's like a lock and key system and that the lock is broken, now you can't lock the door anymore and they keep entering. So there are medication called checkpoint inhibitors. So they are like coming to put the lock back in
Okay.
so that rapidly division stops. So those ones are quite mild with the side effects than chemotherapy, but still have side effects and not ideal. And then you have monoclonal antibodies. So monoclonal antibodies, there are specific antigens on cell types. So for instance, the science is able to find out that, oh, this cell, this lymphoma, there is a particular gene that lymphoma cells present. Now let's design a medication that attack that specific gene on a lymphoma cell. So then we have monoclonal antibodies, but they also come with their side effects as well.
Okay.
And in the treatment, in the line of treatment of cancers, there are phases. So we initially treat people with quite a high dose for them aiming at a remission. So we want to put the cancer at a level that is almost not detectable in the blood.
Okay.
Then we say, oh, the patient is in remission. People go into remission and relapse again, and then the cancer comes back. Then we have other treatment option. For some cancers, when they go into remission and it fail and the cancer relapse, the next option is what we call stem cell transplant.
Okay.
So stem cell transplant, let's go back to what I talked about as the stem cell that is dividing into myeloid, lymphoid, and through that we'll get all the blood cells that we have.
Okay.
So we give you stem cells, new stem cells, for them to now divide and produce fresh generation. So, for instance, let's go back to the biblical Noah term. So we feel like there is too much sin in the cells.
Okay.
Let's wipe it all out with a flood, and let's bring new cells in, and then let them divide into new generations.
Okay.
Stem cell transplants, there are two main types of stem cell transplants, either autologous or allogenic. So autologous is your own cells, and the allogenic is someone else's cells.
Okay.
So autologous is when we give you chemotherapy, you go into remission. That's the cancer is almost not
Suppressed.
detectable in your blood. We harvest your stem cell and store it and keep it safe, frozen.
Okay.
So that either when the cancer resurfaces, or sometimes even if the cancer has not resurfaced, but we feel like we want to give you the stem cell top up so that you can be in a longer remission, we can give the cells back to you. So that is autologous, your own cell. Allogenic is when we need someone else's cells, stem cells. And the allogenic stem cell transplant, for some cancers, that is the only cure. So at the beginning, I said there are some cancers that we still don't have cure, but we have treatments that will keep you, like it will make you it feel like a chronic condition that you'll be treated for the rest of your life, the rest that you have. But for allogenic stem cell transplants, it can be permanent cure for some types of blood cancers.
Okay.
And allogenic stem cell transplant, it's we use something we called tissue typing or HLA matching. So we match it very, very, very straightly. Just think about something like blood transfusion.
Okay.
How we make sure that blood group matches blood group before we transfuse. This
Very
goes
important.
beyond that.
Okay.
So we have to match it very closely. And we need people to match it.
Okay.
There is a short video that Precious, I sent it through today. If you can play that video for me, it's just a short video about stem cell transplants and allogenic stem cell transplants, especially. And then after we play the video, I'll talk about it.
Thanks, viewers. Stick and stay.
Hello, I'm Beverly DeGale.
And I'm Warren Lewis.
And we are the co-founders of the charity called the ACLT, the African Caribbean Leukemia Trust.
Today we want to talk to you about how you can give the gift of life to someone in need and how you can be the miracle that they're looking for. But before we talk to you about our story, we want you to consider what you would do to save the life of someone very close to you.
Our journey started in 1993 when our son Daniel DeGale was 6 years of age. He had been suffering with flu-like symptoms, and on our fourth visit to our GP surgery, we discovered it was something much more serious. A blood test revealed that Daniel was suffering with acute lymphoblastic leukemia. If we had waited another week to receive that diagnosis, sadly we would have lost Daniel. That was the beginning of the darkest phase in our lives. Of treatments for Daniel's leukemia was a 2-year course of chemotherapy and other toxic treatments.
Sometimes I'd have the odd headache or stomachache after I've just had chemotherapy, but at the moment it doesn't seem to be affecting me. Yeah, just try and take it day by day.
It was hard for us all to endure, but it worked. He was released and told by the doctors that he could now enjoy his life again, free from cancer.
However, those fun-filled months didn't last long because in December, a routine blood test revealed he had relapsed. The cancer had returned.
And unfortunately, he actually came home from school on a Friday night to tell us that he'd been made captain of the football team, and we had to break the news that he'd unfortunately have to go back on treatment again. So obviously this time it was much worse.
At this stage, the doctors advised us that the only option left for Daniel was to have a bone marrow or stem cell transplant.
Difficulty in finding a match is that the patient and the donor must be from the same ethnic background. That's black to black, white to white, Asian to Asian, and so on. And their bone marrow type must be nearly identical. We looked for a match in our immediate family. Daniel's sister was checked, as brothers and sisters have a 1 in 4 chance of matching. Unfortunately, Dominique was not a match for her brother. Our extended family was also checked, but no matches were found.
Wow. That's very, very, very sad. I mean, from the story. I mean, take it from here.
Yeah, so this story, as the story goes, it's one of many stories of people struggling to get donors on the stem cell register, especially people from Afro-Caribbean background.
Okay.
Hello. Yeah.
Yeah, go ahead. Yeah.
Yeah. It's one of many such stories. Firsthand, I've had a patient, an African, who only option was stem cell transplant. We couldn't get a donor. Her disease progressed, condition deteriorated. She went down to intensive care unit and we lost her.
Wow.
Firsthand, she was my patient I was looking after. So as I was saying about the allogenic stem cell transplant, and before that, I want to touch on something. I also said something like blood cancers are so very difficult to diagnose because most of the symptoms are like all the other conditions we know. If we watch the video clearly, the mom said Daniel suffered from flu-like symptoms. And it was on about the third or fourth visit to the GP that they found out that he's had blood cancer. And if they had waited for a week, they would have lost Daniel.
That's right.
That goes to support the point I was making that they are so difficult to diagnose. So please, clinicians out there, if people present with conditions, let's add it to our differentials. It doesn't hurt if it come back that it wasn't. But it hurt a lot if we realize later that we could have caught it earlier, but we didn't. So
I don't intend to spite anyone, but am I safe to assume that, of course, this register you're talking about does not exist in other parts of the world where we are coming from?
Sadly, yes, it doesn't.
Okay, all right.
So,
because of course, I just asked because someone may be watching us from elsewhere, may be wondering, stem cell register. I work as a healthcare professional. I haven't heard of this before. I'm just a public. Part of the public. I've not heard of this before, so that's why I'm asking. You're talking about the UK, and hopefully it exists for other developed countries, but not in most developing countries. Is that right?
Yeah. So it exists in most developed countries. And in Africa, the only stem cell register I've seen is in South Africa. I think there is something in the pipeline in Nigeria about a stem cell register. I have to double check that. But for South Africa, there is a register there.
It will definitely be in the pipeline. A lot of things in the pipeline.
And sometimes the pipeline gets choked.
That's right.
So,
all right.
Yeah. And also going back to the video, the woman said something categorically that donors should be black to black, Asian to Asian. This video is quite old. Science has developed since then. It's not strictly black to black, Asian to Asian, white to white, but there is more likelihood that you get a match in your ethnic category than someone outside your ethnic category. So I just want to make that point. So this guy, Daniel, they eventually found a donor for him after 3 years of searching. And Daniel's donor was a 44-year-old woman from Michigan, USA. The good thing about the stem cell register is that it's global. So once you're on the register and your DNA is sequenced and it's on the register, if there is any patient anywhere in the world that matches you or that you are a match for that patient, you will be contacted.
Okay.
So Daniel was in the UK, but he found a match in the US. And that woman, that 44-year-old woman who eventually became the lifesaver for Daniel, only joined the register, heard about the register at church, joined it, and then 3 weeks later was called that you are a match for someone.
Wow.
So Daniel in 1999 was the first Black to have a stem cell transplant in the UK.
Okay.
Prior to that, stem cell transplant has existed. There's a story about Anthony Nolan.
Okay.
It's another register I'll talk to you about. There's a story about Anthony Nolan. Anthony was a child born with a real blood cancer whose only treatment was stem cell transplant. They couldn't find a donor. Anthony died. But because they couldn't find a donor, the mom went ahead and formed a register called the Anthony Nolan Cancer Trust. And up till now, that is the largest private stem cell register we have in the world. So that was 1971. Fast forward 1999, that was the first time a Black person had stem cell transplant in the UK.
Wow.
There could be so many factors involved, but what I think about, or what that tells me, is that prior to that, there were so many Blacks who needed it but they did not get any donor. That is what it tells me. It could be one of the things. Daniel had a transplant in 99, went on to remission, did well, went to college, went to university, and I think 2012 he died.
Wow.
So the stem cell transplant gave Daniel the opportunity to live life for how long? So many years. So as I said, you are the only chance someone might have to live few more years.
Wow.
And when you talk about stem cell donation, someone will ask you, how is it? Is it not painful? Is it not?
Yeah.
So
if we can do this in 2 minutes, James, we have 9 minutes to the top of the hour. It's run so quickly, isn't it?
yes, it does.
All right.
So like the Anthony Nolan Register, I'm part of the Anthony Nolan Register. That's what I'm on.
Okay.
So you go online, Anthony Nolan, which we can put the link in the comments later for people who are interested. But unfortunately, it's for people in the UK.
Okay.
And if you are in any other European country, if you are in the US have a lot of registers in there. If you are in Germany, so register you have in your country. Sign up to it. So with the Anthony Nolan Register, you go online, you fill the form. You are sent a swab, just like a normal COVID swab. So you take the swab of your mouth. There is a prepaid envelope attached to it. You send it back to them, and then they will do your genetic sequencing and then put the information on the register. So once there is a patient who matches your sequence and needs a stem cell transplant, you will be contacted.
Okay.
Now, anywhere in the UK that you are, your transportation, your hotel fee, everything will be paid. And then you go to the center and your stem cell is harvested. Now, stem cell harvest, obviously, there'll be some that they will check if you are healthy, as we check if you are healthy before you do blood donation. So the stem cell collection, back in the days, it was bone marrow that we were using. So there was a big needle that will stick in your bone and collect the cells. But now they'll hook you onto a machine with a needle in your ACF. No, I said I won't say it. In your elbow.
Okay.
So there'll be a needle in your elbow and then another one in the other one. You are hooked onto a machine. I don't know if anyone has seen like a dialysis machine before. It's a machine that looks like the dialysis machine. Okay. So the blood leaves you, go through.
Hi, James. Can you hear me? All right. Thank you very much for sticking and staying with us here on the Discovery Show. The conversation is getting interesting, and James is back now. James, you hooked onto the machine, and what happens?
Yeah. So the machine looks like the dialysis machine. I don't know if anyone has seen the dialysis machine before. So you have two needles, one in your left, one in the right. Blood leaves you, go through the machine. Stem cells are collected out of your blood, and the remaining blood comes back to you.
Back into you. So what you're saying is that it is very safe. It's not a surgical procedure. It's not. It's just a very safe, simple, non-invasive, so to speak. Is that right?
Minimally invasive.
Minimally invasive. Okay, with the needles and all that. That's right.
Yeah. It's not a surgical procedure. You will not sleep in the hospital. You just go in one day, it's done, and you come back. The only time you might have to go twice is that when enough cells are not able to collect enough cells. And also, the only side effect you might have is that before your stem cells are collected, you are given an injection, which we call filgrastim. It's a granulocyte stimulating injection. So it stimulates the production of cells so that when you go for the harvesting, there'll be enough to collect. And the side effect of that injection is bone pain, because it's stimulating your bone marrow to produce more cells. So the bone marrow is going to overdrive, and the side effect of that is bone pain. So the bone pain and the needle that goes in you, those are the only side effects, or those are the only effects you have. And think about
Amazing.
having that effect and being a lifesaver for someone. So
Wow,
it's
incomparable, isn't it?
exactly.
Wow.
So I will
wow.
encourage people, especially us from the Black and Asian community. There is a very alarming statistics on Anthony Nolan website that there is an 80% chance that a Black or an Afro-Caribbean patient will not get a match on the register.
Wow.
So we only have 20% chance of getting a match. But when you go to Caucasians, there is about 90% chance of they getting a match on the register.
Wow, it's been some insightful education here this evening. I must say it's been one of my best interviews so far. It's been education. I think it is very critical, especially for a condition that is poorly, understood, and you've tried your best to simplify that to our understanding. Again, on the other side, beyond what you've said, what I gather is that there's been a lot of improvement in the care for cancer patients. And unfortunately, part of the world, especially where we are coming from, is badly affected because we've not made those, concurrent improvement in our care and in our healthcare system in general. And so this is obviously an appeal to those policymakers that please do your best to improve cancer care. There's hope for those who have cancer. It's not as we perceive, or we usually have those misconceptions and think that once you have cancer, obviously you are gone in a few years and all that. There's a lot that is being done and people are still surviving. James, tell us, congratulations on your recent promotion to the role of Band 6, and that's great. If someone wants to follow in your shoes and also want to get promoted or move into a unit like you are, can you take about 2 to 3 minutes to talk to us about how you got there? Of course, you've spoken about the passion, but what are the other things you did? Are there any courses or models you did to push you to that level? Just take 2-3 minutes to talk to us about that.
Thank you for that. So I will say, look for your niche, look for your interest area. I was lucky I knew my niche. I knew I want to go into hematology, and then I moved towards that. In the UK, the good thing is that transferable knowledge or transferable skill is very appreciated. I had no background in hematology nursing.
Okay.
But I had basic background in general medical nursing. But even before I came here, I'd done an online module. There are so many free online modules out there on FutureLearn, on Coursera, so many things. Just do something like, for instance, if someone wants to come to my field, just do something like introductory in oncology, in hematology nursing.
Okay.
Or go onto the charity group's website, Bloodwise UK, Myeloma UK, Anthony Nolan. Go to those websites. They have courses that give certificates. Just do something like that.
Okay.
And then when you move to like hematology nursing, if you know why you went there, go with the pace. Like go at a pace that nobody is going. Do your chemo course, do your stem cell transplant course, become chemo certified, become stem cell transplant certified nurse. And those are the key skills we need in the unit. So if you're able to give chemotherapy, if you're able to give stem cell transplants, and there is a roll up for a band 6 and you apply, you more than qualify. So just know what you want first, and then look at some of the key skills that you need there. Just do an introductory course in that area. And then once again, when you move there, move at a fast pace.
Abena Enije says, it's a great choice you've made, and we hope to see you become that person and make an impact. Big ups. Robert J says, Scientific James, our boss on the floor. Emilia K2 says, good job, Ura. All the best. Keep it up, bro. Reka Osei says, big ups, Mr. Oppong. Isaac Dixon says, insightful session there. Well done, Mr. Oppong. Nanama Beidus Lisby 87 says, good work done. Adorable Jane, of course. Your own wife says, boss, for this one, we need a lecture room. Good job, proud of you. Adjoa says, my one and only in charge. Never met a dedicated person so passionate about hematology-oncology and does his best to make a difference. QE UHB is proud to have you. Thumbs up. Evans Bobier Atobra says, very educative and informative. Keep it up, bro. Our own Justin Dari says, well done, Precious and James. Ernest Obin says, this was a lecture, very insightful. Brimpon Tutu Esiedu says, we are proud of you, sir. How do you feel being here today as a guest, James?
Well, when I first posted the flyer, I was like, time to have a dose of my own medicine. And I think I've had it.
Okay. Wow. Fantastic. I have enjoyed this, every bit of that. It's been very educative. I mean, it's literally more like reminding me of all these things I've learned, and some of them were new to me as well. Of course, you are more particular in this field as well. So I want to say a big thank you to you for all your contributions towards this show and the impact we've been able to make in our own small way. I want to believe for healthcare professionals and even non-health people of non-health background have learned a great deal today from what you've taken time to explain. And I want to believe it will make that impact we are looking forward to. So any final words for us? Any shout out? Anything? Yeah.
My final words, please, if you're in the UK, in the US, Germany, everywhere, any developed country, please look for the stem cell register and enroll onto it. It's so disheartening to lose a patient because the patient did not get a donor. Who knows if the transplant might not have worked, but that patient did not even get the chance to see if it will work or not. So please, let's give people the chance. And then again, another last words, something back home. Please, as I was saying about the contributing factors to cancers, the illegal mining, the mercury. I don't know what will happen in the next 10, 15 years, the next 20 years with cancer prevalence in those communities.
Okay.
It's time some people take responsibility and act as leaders. The rhetorics are too much. Thank you.
Thank you very much, James. And of course, Jessica Aram Kweduga says, I enjoyed how progressive your explanations were structured, James. This was amazing, more than a lecture, and I'm so proud of you, dear. Thumbs up. Thank you very much, everyone who made the time to watch us and join us here. We will plead with you to subscribe to our channel here on YouTube, on Facebook, on Instagram, and on Twitter. Our handles are just The Discovery Show TDS TV, The Discovery Show TDS TV. And as you've rightly witnessed, we seek to bring you accurate information, some sort of education about career progression, and many other things. And we are not only specific to one sector. We look at many things. So thanks very much for joining us, and we hope you've definitely learned something. My name is Precious Adadidiudu, and I was speaking to my own producer on this show, Mr. James Kwabena Oppong, and it's been a blessing having him. And we want to say have a lovely day, have a lovely evening and afternoon, morning, wherever you are watching us from. And we hope you have a very wonderful time this week. Stay blessed. God bless you. Thanks, James. And thanks,
Thank
viewers.
you, Precious. Thanks for having me.
Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before they blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. True. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Perry Precious. Executive Producer, James.